Hey guys, Sean from Technique Peak here. Today we're going to talk about a test to do with someone who has pain with weight bearing to differentiate whether it's between the weight bearing structures of the hip, shearing of the SI, or side bend of the lumbar spine. You can do this to help guide which area of the body to assess on your evaluation. Alright, so for the first part of this test, we just want to assess if they have pain with weight bearing. So say he has symptoms on his right side. We're going to have him shift weight onto his right leg and see if he has any pain there. And if he does, then we'll proceed with the test. So now you can return to neutral. What you're going to do is you're going to have them stand feet a little bit wider than shoulder width apart, so that way you can have a little bit of room and the symptoms don't just come on right away. So then what you're going to have the patient do is shift the weight towards you just until they start to feel their symptoms. You start to feel your symptoms there? Just cross your arms across your chest. And then you're going to come right underneath ischial 2 and right on ASIS and lift up, okay? And that's going to take weight off the weight-bearing structures of the hip, and you're going to ask the patient if that's better, worse, or the same. With this, you're alleviating the hip, but you're further shearing the SI and side bending the lumbar spine. And if you ask the patient if it's better, same, or worse. If they say better, you can confirm by coming on the other side, okay? Have them shift just until they start to feel their symptoms, and then come just off so they're on the verge of their symptoms, and then you can put more load through the hip to see if that provokes their symptoms. So now that we've assessed the hip, if that did not alleviate the symptoms, then we would look into the SI. So what we'll do with the SI, same thing, you're going to have them shift just until they start to feel their symptoms. You have your symptoms there? You're going to place an arm around the front of them so that way you don't push them forward. You're going to come right under sacrum and give a little lift up to decrease the shear in the sacrum with the weight bearing, and ask the patient if that is better, worse, or the same. And if they say better, to confirm that, you can have them shift just until they start to feel their symptoms, have them come off slightly. You're going to come just on top of sacrum there, and you're going to give a little downward pressure to further shear the sacrum to see if that provokes their symptoms. So the last part of the test is to confirm the lumbar spine now that we have cleared the hip and cleared the SI. So with that, we will have them shift their weight just until they start to feel their symptoms. We'll come just underneath the rib cage, give a little grab around there, lift straight off, okay? See if that's better, worse, or same to confirm the lumbar spine. And then based on where you were able to provoke and alleviate, will help guide where you assess during your evaluation.